look down right now. Are your legs crossed? I mean, it feels comfortable, sure. But biomechanically, well, you're driving a car with terrible wheel alignment.
Yeah, you really are.
Right, and you don't notice the wear and tear at first, but eventually the pelvis tilts and, your muscles overcompensate. So today we're doing a deep dive into the surprisingly complex world of hip health. We want to cut through the noise of internet advice and understand why everyone's pain is just entirely unique.
It's a complete mechanical chain reaction, honestly. And what's fascinating is that the breakdown it doesn't look the same for everyone. Like when you throw off that pelvic balance, your piriformis muscle might clamp down directly on the sciatic nerve.
Oh, wow. So that's sciatica.
Exactly. Yeah. That sharp, burning electrical shock shooting down your leg.
Right.
Or you might just develop myofascial pain, which is essentially deep, stubborn muscle knots clamping down around the joint.
That distinction is crucial because, my very first instinct when my hip hurts is to just stretch it out or grab a massage gun.
Oh, sure. That's what everyone does.
Yeah. But aggressively stretching an irritated nerve is actually a terrible idea. Unlike a tight muscle fiber that needs to be physically lengthened, an inflamed nerve fiber is already highly sensitized.
Right. It's already angry.
Yeah, so if you stretch or violently massage it, you're causing micro tears and chronic damage that's incredibly hard to reverse.
Exactly. You're just adding physical trauma to an already compromised structure. And that instinct to just stretch it out or find a quick fix is exactly what traps so many people when the pain gets worse. Take Terry's case from our sources, for example.
Right. His story was wild.
It was. So he started getting a little stiff getting out of a chair, and it eventually progressed to just agonizing nighttime pain. He did the logical things, physical therapy to build strength and acupuncture to manage the nerve pain.
And then he did what we all do. He posted about it online.
Which is almost always a mistake.
Oh, totally. Instantly, he was flooded with conflicting, deeply polarized advice. Half the comments are yelling to never get surgery and that PT is all you need, and the other half are swearing that a hip replacement changed their life and he should do it tomorrow.
Which perfectly illustrates why social media likes shouldn't dictate your medical care. No two hips are exactly alike. When Terry finally got x-rays, they showed severe osteoarthritis. His cartilage had worn away entirely.
Wait, so it was literally bone grinding directly on bone?
Literally bone on bone. At that stage, physical therapy and acupuncture hadn't failed him. His physical mechanics were simply too damaged to save.
Right, the structural integrity was just gone, which means surgery was inevitable at that point.
Yeah.
And the actual procedure sounds like, literal carpentry.
It really is.
The surgeons use this tool called a reamer, which is essentially a round cheese grater attached to a drill to carve out and smooth that diseased bone socket.
Yeah, they're doing complete reconstruction in there. And after they clear the damaged bone with that reamer, they don't just hammer in the final parts.
Wait, they don't?
No, they actually use trials, so practice parts, to test the tension and leg length. They have to ensure the biomechanics are perfectly balanced before they insert the permanent metal cup, the plastic liner, and the brand new titanium head on the femur.
Given how aggressive that sounds, you'd assume a patient would be bedridden for weeks. But the recovery timelines here are completely counterintuitive. You can actually be up and walking the exact same day.
You can, yeah, but it takes significant work to heal the surrounding tissue. And this is where Terry's journey flips our usual expectations. We often think of Eastern and Western medicine in opposition.
Right, like you have to pick one or the other.
Exactly. But Terry used acupuncture not as an alternative he tried before giving up on surgery, but as a secret weapon after his joint replacement.
That completely flips the usual narrative. Instead of choosing between them, it's a tag team approach.
Precisely. By targeting specific pathways, acupuncture releases endorphins and increases local blood flow, which actively flushes out surgical inflammation.
Oh, that makes so much sense.
Yeah, it calms those freshly traumatized nerves and supports rapid healing right alongside standard physical therapy.
So it's using the right tool at the exact right time. I think the main takeaway for us today in this deep dive is clear. The best treatment matches your specific internal diagnosis, not whatever happens to be trending online. Your hip pain and the path to fixing it is entirely your own.
Absolutely.
Okay.
And I'll leave you with this final question to ponder. If our physical joints are this uniquely individualized, how many other health decisions are you currently making based on the loudest online opinions rather than what your own body's internal blueprint actually requires?